which is doing the training to do the certification. Is that curriculum available? Could we leverage that into Alaska, develop an AHEC there to, you know, build on the community health worker? Thank you.
Is this working? To answer your question about the AHEC in Alaska, I'm not familiar with that. They had the, let's see, was it the National AHEC met? No, that was the National Rural Health Association met in Alaska, I believe, last year. I didn't attend that. That would be something that you could look into as far as developing an AHEC in your state. That is a state-by-state issue. And not every state has an AHEC, but there are, I think, 42 states that have them. Is it 48? Thank you. I'm not up on my math on the national AHECs. But yes, that would be a possibility, sure. And as I said, we are updating our curriculum. It is an AHEC curriculum, and if I'm not mistaken, it's going to be available if that would be something that your state would approve. It's an approval process, and ours has been approved by the state of Texas.
And just as a quick comment, I know that we have linked, or I shouldn't say linked, we've identified the Alaska resource as one of the resources that we'd like to include in the toolbox. But if you have a specific person that you think would be a good resource, I would very much welcome getting that name and contact information to make sure that we have the most current resource available for the online web toolkit.
Okay, I think we have time for one more question. Or we have two more people? Okay.
One more.
Okay, we'll take yours and then yours.
Okay, Dr. Wade Hanna from the Georgia Health Policy Center. Just one comment and one question for the training of the promotores, because I was glad to see you had included cultural competency within the training for the promotores, because it isn't only the matter of sharing a common language and having common ethnicity that makes one effective promotora, because what is necessary, because of the diversity in the Latino population, you will find that even in the same country, individuals, for instance, in Mexico, from Yucatan, will only speak Mayan, preferably, rather than Spanish. And so it's really important to have the promotora from the community level. They understand the language, they understand the culture, and more importantly, for those people who speak Mayan, Spanish is a second language. The question I wanted to ask is, within the Latino community, do you look for individuals, for instance, from Latin America, who perhaps might have been in their country healthcare professionals, or even curanderos or herbalistas, anything like that, and then train them to become a community health worker?
I personally have not encountered someone with those characteristics, but I'm pretty sure if they're willing to be trained as a community health worker, that wouldn't be a problem. So if they have those skills already from Mexico, it's a plus for us. So definitely.
Hi, Oscar Gomez with Health Outreach Partners. I had one question over here. I just had a comment about that. I think the cultural competency piece is critical. The one thing I think that is probably essential in the cultural competency piece that I think sometimes we forget to add is the commonality around socioeconomics, because even within the Latino community, you know, there's this tendency for us to say, oh, we're culturally competent, but we're very disconnected. You know, I'm first generation American here, and thankfully my parents, you know, raised us with both cultures, but there is still, there's a conscious disconnect that I feel. And so I think, you know, Adalinda, you know, I think what's great about what you all do is that, you know, you really look at the work experience and the lifestyle that your families have. So I would say that that's probably one of the top pieces in cultural competency, and yet we don't talk about that a lot. I think the socioeconomic connection, commonality is really key. The one thing I wanted to say about, you were talking about some of the different models that are out there. FQHCs are doing a lot around that right now. A lot of FQHCs have what they call their outreach programs or community service programs, and they have a variety of models. They'll do the traditional promotora model. They'll have clinical outreach where they have a whole set of clinicians that do that. They tend to do as a team, and so they're really looking at that. And if you're going to look at a curriculum or certification, I think the two states to talk to at the primary care level with the FQHCs are Texas and California, because what they're doing is they're trying to get a certification program for reimbursement. And the one thing, if you do that, well, no, because I think they just scaled back, but they're actually having a roundtable tomorrow with a couple of assembly Thursday. But yeah, they're going in that direction. But I think one of the things is that they really it's a community-wide effort. Well, my point being that it's to talk to those states for the model. I think in the end, folks are interested in that as well. So anyway, I think there's several FQHCs out there that have a lot of those models, and that they sort of, it's funny because they don't operate in a sense where they're different. They all kind of just mesh together based on the need. But Texas and California have some really good stuff, and North Carolina actually also. So.
And that is our long-term goal, is to have the services reimbursable, and we are working on that. We are fortunate, like I said, to have a very strong program office at UTMB, the medical school, East Texas AHEC. They're very active at the state level, and we think that is a possibility. We're investing time in that. It may not be an easy thing to do. It may take several years, but that is definitely a goal. And that's why our data and being able to tell the story and the return on investments and try to track as much as we can the type of activities, obviously, the community health worker is doing. And we think that, probably 2 to 4 years possibly, that's a possibility. But a standardized curriculum, it looks like, is the one thing that we've heard needs to be done. I think Minnesota is one of the first states to be able to be reimbursed, and that's what they had to do before they furthered their cause at the legislative level.
Okay, well, thank you very much. That was excellent.